5 Deadliest Diseases in History. When people think of the most dangerous diseases in the world, they immediately think of incurable, fast-acting diseases. But in fact, many of these diseases are not in the top 10 causes of death worldwide. An estimated 56.4 million people died worldwide in 2015, and 68% of them were due to slowly progressing diseases. Perhaps even more surprising is that some of the deadliest diseases are partially preventable. Factors that cannot be prevented include where a person lives, access to preventive care, and quality of health care. All of these factors enter risk. But there are still steps people can take to reduce their risk. Read on to see the top 10 diseases that cause the most deaths worldwide, according to the World Health Organization, WHO. 5. Stroke. A stroke occurs when an artery in the brain becomes blocked or leaks. This causes brain cells that are starved of oxygen to begin to die within minutes. During a stroke, you feel suddenly numb and confused or have trouble walking and seeing. If left untreated, a stroke can cause long-term disability. Risk factors for stroke include high blood pressure, family history of stroke, smoking, especially when combined with birth control pills, being African American, being female. Some stroke risk factors can be minimized with preventive care, medications, and lifestyle changes. 4. Diabetes. Diabetes is a group of diseases that affect the production and use of insulin. In type 1 diabetes, the pancreas cannot produce insulin. In type 2 diabetes, the pancreas does not produce enough insulin, or the insulin cannot be used effectively. Type 2 diabetes can be caused by a number of factors, including a poor diet, inactivity, and being overweight. People in low to middle income countries are more likely to die from complications of diabetes. Risk factors for diabetes include excess body weight, high blood pressure, older age, not exercising regularly, unhealthy diet. Although diabetes is not always possible, it's preventable, but you can control the severity of your symptoms by exercising regularly and maintaining good nutrition. Adding more fiber to your diet can help control your blood sugar. 3. Tuberculosis. Tuberculosis, TB, is a lung condition caused by the bacteria Mycobacterium tuberculosis, which is a treatable airborne bacteria, although some strains are resistant to conventional treatments often. Tuberculosis is one of the leading causes of death among people living with HIV. About 35% of HIV-related deaths are due to TB. TB cases have decreased by 1.5% per year since 2000. The goal is to end TB by 2030. Risk factors and ways to prevent it. Diabetes, HIV infection, lower body weight, being close to other people with TB, regularly taking certain medications such as corticosteroids or drugs that suppress the immune system. The best prevention against TB is the Bacillus calmette-guerin (BCG) vaccine. If you think you've been exposed to TB bacteria, you can start a treatment called chemoprophylaxis to reduce your chances of developing the condition. 2. Cirrhosis. Cirrhosis is the result of chronic or long-term scarring and damage to the liver. Damage can be the result of kidney disease, or conditions such as hepatitis and chronic alcoholism. A healthy liver filters harmful substances out of the blood and brings healthy blood into the body. When substances damage the liver, scarred tissue forms. As more scar tissue forms, the liver has to work harder to function properly. Eventually, the liver can stop working. Risk factors for cirrhosis include chronic alcohol use, accumulation of fat around the liver, non-alcoholic fatty liver disease, chronic viral hepatitis. Stay away from behaviors that can lead to liver damage to prevent cirrhosis. Helps prevent cirrhosis. Long-term alcohol use and abuse is one of the leading causes of cirrhosis, so avoiding alcohol can help you prevent damage. Likewise, you can avoid non-alcoholic fatty liver disease by eating a healthy diet rich in fruits and vegetables and low in sugar and fat. 1. Ebola. Reports issued by the CDC indicate that 28,616 people were infected with confirmed or probable Ebola, and 11,310 died over the course of the 2014 to 2016 outbreak. In the U.S., 11 people were documented as having Ebola, 4 of whom had developed symptoms once back in the United States. 7 of the 14 had been medically evacuated from other countries. 2 died. Even though the World Health Organization, WHO, declared the end of Ebola outbreak in Liberia on the 9th of June, 2016, there is always a risk of Ebola in countries with very weak health systems and where the virus is prevalent in wild animals. Small outbreaks continue to happen, and efforts to contain them are often hampered by conflict and violence in the area. Thank you for watching. Take a good care of yourself. Don't forget to subscribe.